All right. Hello and welcome to our nursing philosophy presentation. We're doing the environmental model, and our topic, our person is Florence Nightingale. The people in our group are Haley Alexander, Will Breyer, myself, and Brandon Cousin. In our presentation, we'll talk about who Florence Nightingale is and why she's significant in the world of nursing. We'll talk about her particular model, the environmental model, and we'll talk about how it applies and how to apply it in a clinical setting. So first of all, who is Florence Nightingale? She was born in Florence, Italy in 1820 to a wealthy English family. And as a child, she was particularly gifted and she displayed uncharacteristic levels of curiosity and intelligence, which was especially unusual for young girls at the time. She studied Greek, mathematics, history, art, and philosophy, which was pretty unusual. She was very well learned, and her parents, she fought them about being a nurse. That was something she really wanted to do, and they were quite unhappy about hearing that she wanted to be a nurse at the time. So the two kind of formative experiences that she had over the course of her life was, of course, the first being alive during the Victorian era, and the Industrial Revolution, and the Crimean War. Um, those two experiences that she encountered firsthand kind of shaped her philosophy on nursing and what it should be, because it was something she wanted to do since she was a kid. So how it was formative was she observed the suffering and the pain caused by rapid and mass industrialization. And she was a very empathetic person, so she empathized with the misery caused by the prison complex and the industrial workhouses at the time. There were no safety regulations, lots of injuries and maimings and deaths. Um, and in 1851, after many years of arguing with her parents and trying to go to nursing schools, she decided that she was going to go out on her own, and she attended nursing school at Kaiserswerth. Um, there, she wrote many um, articles and papers about what nursing should be, but her most famous one was called Cassandra, and was about her disagreements with Victorians' women's lifestyles at the time. She disagreed uh, with their tendency to kind of hang out at the house and live off of their husbands' incomes and not really contribute anything meaningful to society. And she had a problem with that, so she wrote this treatise about it. The second formative experience for her was the Crimean War. Um, After the war began, reports of horrific injuries and battlefield treatment of the soldiers started to make its way back to England, and the public sentiment put a lot of pressure on the Secretary of War. So when that pressure was applied, he selected Nightingale to be in charge of the entire division of female nurses because of the numerous papers and treatises and things that she had written. So he put her in charge of the entire division of female nurses, everyone in the military. So in order to exercise that, she and 38 nurses, um, most of them having no formal training, went and joined the frontline hospitals. And the main one that she went to had between 3 and 4,000 injured men in it. And in this facility, only designed to hold 1,700. The conditions were atrocious. It was said that there was only 18 inches between each bed for 4,000 people. So, you can see how closely packed that was. There was, you know, people were naked and they were laying out. There was no pads. It was pretty horrific conditions. This is an artist rendition of what it looked like. Um, they had no delineation between like the sick, the dying, and the dead. They just kind of threw everybody together in piles. Obviously, that's not great for medical sepsis or treating wounds or helping people heal. And the entire facility was essentially on top of a sewage pit. So there was rampant infection, rampant diseases. There was vermin, rats. There was no cleaning supplies or something to keep it clean. So that environment was obviously not conducive to healing, and she was very mad about that. Uh, so while she was very concerned about the environment and the treatment of soldiers, at the time, germ theory was still a new concept, and Nightingale never actually formally accepted it. But the things that she did and the philosophy that she came up with, that Haley will talk about, indirectly followed germ theory, even though she didn't believe there were actually germs. The things that she did prevented their spread and growth. She demanded clean living environments and nurses. And her focus was on keeping the patient and the environment as clean and as comfortable as possible. And her goal was to provide humane treatment and to completely overhaul the administrative side of military medicine, because there hadn't been a lot of focus put on the actual like medicine part of the military medicine. It was mostly the military part. Um, so my personal philosophy in nursing is a very pragmatic one. I like to be practical with how I empathize and want to help people get through nursing. So I empathize with them very heavily, and I really resonate with the way that Florence Nightingale like observed all these things, and she was like, "I'm going to do something about that," and I really that resonates with me personally. It aligns with my personal philosophy of nursing that the environment and the nurse play a direct role in patient success outcomes. If we don't put in the work ourselves and we don't make an environment that fosters healing, the healing is much less likely to happen. And that's one of those big things that we need to work on. And of course, empathy is the key to understanding how effective a nurse can be. We need to understand how our patients are feeling, and we need to do what we can. We need to essentially do what we would want someone to do if we were in their position. That's how we should act as nurses. And I think that's the best way to go about it. So now we're going to hand it over to Haley.
Nightingale's theory emphasized the importance of the environment and health and healing. It is a concept that is still used today in modern nursing. Florence Nightingale is often called the founder of modern nursing, and her environmental theory shows how nurses care for their patients. Nightingale identified key environmental factors that influence health promotion, the first being ventilation and warming. Nightingale mentions the need for fresh air and ventilation to keep patients stable and improve their health. She also believed that patients should always be kept warm and comfortable. She talks about the health of houses, which is pure air, water, efficient drainage, cleanliness, and light. Another important factor is petty management, which refers to the continuity of care even when the nurse is not present. Noise was another component of her theory. She believed that a quiet environment was more peaceful and not as stressful for her patients, which helped promote recovery. Excessive noise can disturb patients and make it hard for them to heal and recover. It can also affect their anxiety or depression. She believed in finding ways for patients to avoid boredom and depression. Nightingale also mentions the importance of nutrition and receiving enough hydration. She believed that beds should be dry and wrinkle-free to ensure comfort. She also believed that adequate lighting can be beneficial and promote healing. Cleanliness of walls and rooms helps prevent infections and promotes healing for the patients. Nightingale wanted to keep the environment as clean as possible. Lastly, she emphasized the importance of bathing and grooming to contribute to the patient's physical and mental well-being as well. She also discussed the importance of offering hopes and advice to the patient, but not offering false reassurance to the patients. She also thought it was important to observe the patients closely and make sure they were receiving the care that they needed. Nightingale believed that environment plays an important role in recovery. Nurses help create a healing environment through cleanliness, noise control, ventilation, and more. Environment can be both external and internal for patients, which helps promote health. Nursing is both a science and a calling, focusing on promoting health through environmental management. My personal philosophy of nursing is that nursing is about more than just physical care to patients, but also about creating a healing environment for patients, an environment that offers them empathy and compassion. Her theory focuses on external environmental factors, whereas my theory focuses on the importance of emotional and relational aspects, including advocacy and leadership.
All right, so the environment in a clinical setting. So, as Haley mentioned, um, Florence Nightingale's main thing was creating an environment that is conducive to increasing patient outcomes. So that is basically what can adjust, like what can a nurse adjust in their environment to promote a better outcome for the patient. So for example, in a pediatric clinic or pediatric hospital, um, you want it to be bright and cheerful just to ease children's anxiety. Um, Overall, despite like what department you're in, you want to maintain a cleanliness and like hygiene just to prevent the spread of infection, especially for immunocompromised people. A way that we do that is controlling temperature, air quality, um, just to also improve comfort and health. So the nurse's role, like I said, was just to like adjust the factors that you can to create a comforting environment for the patient that is also beneficial to their health. So that is child friendly or patient friendly, clean, comforting. Um, like Haley said, we want to monitor the noise level to just reduce the overall stress for patients, and then we'll be working with child specialists or just different social workers to adjust what we can for emotional and psychological well-being as well as their physical well-being. The impact on patient recovery and patient care. Just promoting a better environment would lead to a faster recovery by limiting those external stressors, like noise and just other anxiety inducing factors. We'll also be preventing infection, which is really important for vulnerable populations, immunocompromised children, older patients, and just overall, just promoting a calm and healing atmosphere that supports the overall care of the patient. So, how this model applies to my philosophy of nursing, I personally believe that nursing is the core of nursing depends on patient centered care. So, Nightingale, she focused on patient centered care and individualized needs. And, like Haley said, focusing on the patient and monitoring the patient closely to see what they need. Um, she also included the importance of holistic care and just the overall well-being of the patient, especially and just by benefiting that by the changing up and adjusting the environmental factors such as cleanliness, air, and light, which is crucial to recovery. The holistic approach, I feel like we both emphasize the that care is beyond the physical health. It also includes their mental, social, just approaching the patient, I'm sorry, approaching the patient as more than a set of symptoms. You have to treat their physical, their mental, and their emotional needs. Um, and that environment that they're in and the things that you can change can directly influence the mental, emotional well being. Um, her her idea focuses on overall health, caring for the whole patient, their emotional needs, and all. So the nurse's role is to monitor and adjust the environment where you can. Environmental control aids patient recovery, and it just aligns with my belief to be an active nurse and be involved in patient-centered care directly. Thank you for listening. This has been our presentation.